You'll often hear when dealing with other drug addictions that people have to wait till they bottom out before they're really going to stop using. And this was something that was believed for a very long time, that there's very little you could do to help somebody stop a drug until they would bottom out. And I got to point out, this did work in other forms of drug addictions. When you were dealing with alcoholism and you're dealing with heroin and you're dealing with, other hard drugs, people would often, really bottom out badly, and it would be the motivation to quit. Well, bottoming out, with alcohol, you could have a DUI. You could end up in jail. You could end up with, other drugs, losing your job, and again in jail. You could have these horrible life consequences where you lose your family. Again, you lose your job. You lose your career. Terrible things can happen to a person. And sometimes it will even, result in death. But many times you would have these catastrophic life circumstances that would end up having, some very long-term ramifications, but often over time people could recover. Sometimes they end up, getting their family back. Often they have to end up getting a new family, getting new jobs, getting new careers. I mean, starting all over again from the bottom. But, over the years in programs, I met a bunch of people who were very highly successful people at this point in their life who really did get their lives back on track after these horrible experiences from, again, other drug dependencies. Now, the theory also held true that people would say, like, well, with smoking, people just have to bottom out. They're just going to have to bottom out before they're going to quit. There's a problem using that theory when it comes to smoking. It's, what is bottoming out with smoking? In most cases, people don't lose their family because of smoking. They almost never end up in jail because of smoking. They may have some horrible things go on, but it usually isn't going to result in, a jail term that's going to put them away for, for years. They probably won't lose their job. I mean, it happens maybe sometimes, but it's not that common of a problem where people lost their job because of smoking. If you work with this theory of having to wait to bottom out for smoking, you better understand what bottoming out with smoking usually means. You know what bottoming out with smoking is? It's diagnosis. It's diagnosis of a smoking-induced illness. And while people may get their lives back from bottoming out from other drug dependencies, from these horrible circumstances that can happen and often do, waiting for a diagnosis to quit smoking of a smoking-induced illness is playing Russian roulette, because we're dealing with diseases that if you wait till you have them, you may not be able to recoup your existence. It may be the end of you. Again, when you're dealing with diseases like emphysema, when you get diagnosis, okay, you might be able to go a long time, but you're going to have impairment. But the other diseases like lung cancer, you may not have long at all. And I also got to point out, for people who think, well, when it really gets bad enough, they're just going to stop. They're going to get some warning signals. Something will all of a sudden click, and now they know it's time to quit smoking. You got to understand something. Some of the diseases that smoking causes, sometimes the first symptom is sudden death. Waiting to bottom out with a disease that the first symptom is sudden death, again, you waited too long. There's no chance at that point in time to recoup anything. You've got to be careful walking around with this idea you're going to quit one day when the time is right, or again, when it gets so bad, when things just, pile on so horribly, you'll just know it's time. It might be too late at that point. And again, you may not get the opportunity at that point. You may not get the desire, the strength, or, and again, in the case of sudden death, you may not get the opportunity. Don't wait to bottom out. Try to learn all you can about smoking to understand how smoking can bottom you out. Use that information then as your motivation to get a quit going, and then to keep that quit going, so you never have to face bottoming out types of circumstances. Then to avoid ever bottoming out from smoking again, it'll be just a matter of sticking to the personal commitment you hopefully made the day you stopped to never take another puff